Here. 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 Here.
And Representative Zent.
Here. Is anybody online?
It's just Tim.
Just Tim, okay. Just Tim, okay.
Or 10.
Thank you. The first order of business is to approve the minutes from the quarterly meeting, ad hoc and commission task force meetings. Does anybody have any comments on the minutes? Has everybody reviewed them? I'll take a motion to approve them en masse.
No. Make a motion to approve the minutes.
I'll second it.
Any discussion on the motion to approve the minutes? All in favor, say aye.
Aye.
I don't think we have to do a roll call since we have nobody online, right?
You got it.
All right, moving on. We have a presentation this afternoon from the VA HUD VASH Veterans Health Initiative Clinic.
Yes.
I assume that's you. You're not Kendall, I don't believe.
Yes.
Oh, are you Kendall? Okay.
Yeah.
All right.
Some people
I
at the table.
apologize for the name.
Yeah. Thank you for having me. So I'm Kendall Enzinger. I am the homeless coordinator for the VA Medical Center here in Indianapolis. That serves our whole catchment area. So I am going to talk a little bit about our homeless programs and services today. I brought some goodies because I'm a very interactive presenter. So there's some things on the back table to take with you. One, that's because one of the biggest parts of my job is to make sure the community and as many people as possible in the community know how homeless services works for veterans. That can be a very confusing task. Homelessness and how the system works actually nationally has changed a lot in the last decade. And so you're going to hear things like coordinated entry, and you're going to say, what is that? I will explain it, but I promise you it would take years and years and years for anybody to ever truly understand it. It's like everything else in the government. So it's got layers, but I do believe I've simplified it. I'm going to talk a little bit about the different programs we have and how it's designed. But I think the biggest piece of today is just understanding that our programs serve the catchment area, not just the metropolitan. So this includes all of our rural counties that fall under us. We are right around 32 counties. So we expand almost the whole middle section. We go all the way far down to Jennings County. So there's a lot of work being done related to veteran homelessness that sometimes I don't think the VA puts out there enough for people to know how much we are really doing. A lot of our work is in collaboration with the community. So a lot of times what we really encourage is our community partners take the lead in what they are doing, because they're the ones that we want to shine. You know, the VA relies on these partnerships throughout our catchment area because, well, let's be honest, it's a community's role to really support homelessness, not just veteran homelessness, but homelessness. And so that's kind of part of the model federally now. So federal HUD, in their grand wisdom over time, has come up with something called coordinated entry. And this is a buzzword that's very, very important to know, because any individual and experiencing homelessness generally has to go through coordinated entry. It means a point of entry in the community to be assessed for their need. And that way we can match them to the best program that we have available. The reason federal HUD moved to this model is because what we were finding nationally is a lot of individuals experiencing homelessness would go to different agencies and receive the same service. And then you have one person that maybe they are not comfortable reaching out, and so they're not receiving a service. So coordinated entry is really in itself the coordinated way for all individuals experiencing homelessness to get an equity of services. That includes our veterans. I've been doing this for about 15 years, so a little bit about myself. I'm a licensed clinical social worker, and I'm a board certified complex case manager. I started at the Central Texas VA at Fort Hood because my husband's a combat veteran, and I'm with what they say is true about Fort Hood. Once you get assigned there, you never leave. So we spent a decade there, and not only did I fall in love with our military culture, but I really found my calling towards veterans and didn't know it, but homelessness and the mental health and the substance use disorders that come along with that were really where I fell in love. And it's mostly because I saw young soldiers where the early indications of issues started in the service, but a lot of times we weren't getting them until their late 50s, their 60s, you know. And so there's this continuum that I sort of saw happening. So I have always worked with veterans experiencing homelessness for 15 years outside of the short time that I spent at Fort Hood. So it's a very impassioned part of what I do here for the city, along with my work with Veterans Affairs. So let's say you have a veteran that is experiencing homelessness. They're going to be encouraged to make contact with a community-based agency for coordinated entry assessment. I have some very handy handouts for that. If you have not seen this, you're missing out, because this is the system on paper. It is not pretty, but it is very helpful. And this is how a lot of people start their journey. This is something that's called the continuum of care, or keys to housing. So Indianapolis is required to collaborate as a community, as a metropolitan community, to address homelessness at large. Veterans are a part of that. So a lot of times, if you've heard of CHIP, the Coalition for Homelessness and Prevention agency here, CHIP is how they're known. They are our lead agency for the metropolitan area. They are the ones that kind of lead all of the efforts related to homelessness, and veterans are a part of that. And so on this form down here at the bottom, there's all the access points for veterans here, right? But that doesn't exclude the VA. So one of the things that we do is we try to operationalize. We have a national hotline for homeless veterans. If you haven't heard of that, I have some goodies in the back to take with you. That is two ways that veterans experiencing homelessness can get to us, right? We give this out to direct them to the agencies, but we also encourage veterans to call that national hotline. What it does is it routes that veteran to my team. There's 60 of us, okay? Every member of that team helps with that call center to direct veterans on where they need to go for assistance. That can be as easy as, hello, Veteran Jones, I want you to give this person a call, and that works for that veteran. I have some that, oh, Veteran Jones, it sounds like you're going to struggle to make contact with them. We're going to walk you through it. We're going to take you there, right? So each veteran scenario looks a little bit different based on the veteran's ability to navigate these services and resources. So I think that's something that's really key, is the veterans that struggle, that have complex conditions, whether it be mental health, substance use, or a complexity of, we do a lot of case management services with that, and you're going to see that in the outlined program snapshot. So it's very rare that a veteran doesn't have some type of support through the system. Some may have more than others because some have different needs than others. We try to individualize our support as much as possible. Because veterans that can navigate it, they don't need us as much, right? We have to watch our time. That doesn't mean they don't call us again. We get people that call us again, and we want that. But so you might see a diversity within the programs I'm going to talk about on different ways that we serve the veterans that are experiencing homelessness. So one of the significant things to understand about veteran homelessness is, again, everything's in collaboration with the community. So we have some transitional housing programs. If you want, there's a slide on VA transitional housing and contract residential in that PowerPoint. It is the very next slide after coordinated entry and homelessness. Yep, perfect. We have transitional housing. This is the housing that we have acquired and cooperatively with our grantees. So everybody is familiar with HVAF, right? Or Homeless Initiative Program, Volunteers of America, These are very well-known agencies. We partner with all of those to provide transitional housing programs for our veterans who are interested in a transitional option while they are getting on their feet. Maybe they're making plans for permanent housing. Maybe they're addressing their mental health, their addictions issues, their financial management issues. So a lot of folks will say, oh, HVAF, yes, we partner with them. Their transitional housing program is actually our transitional housing program. We provide the funding for them to provide those services. We work with HVAF every day on the veterans that are in those beds. How do we make sure that those beds are getting served well? There's a part of my team that is out on street outreach today in the cold. And if there's somebody that would like to participate in the bed in our programs, we bring them in today. Let's get them in bed, right? So this is why I said we're really dependent on the community. Our transitional housing is provided through the services of community-based homeless service providers like HVAF, Homeless Initiative Program. We also have a contract residential program with Volunteers of America. They have a program that's deemed emergency housing. So we have 24 beds there to where if a veteran's on the street and they're needing an emergency shelter situation and they're willing to come into that program, into that bed, we will get them into the bed today, as long as there's availability. Yes.
I have just a quick question.
Mhm.
On the per diem, how can communities kind of work with those organizations? In my community, we lost two veteran facilities no longer have their per diem.
Yes.
So they're working hard to get that. So how can the community team up with HUD-VASH to ensure that they don't lose that per diem and kind of have some veterans fall through the cracks?
So generally, this is how I just talked a little bit about what we do. So in terms of our how to maximize or recruit new service providers into participating in a grant per diem, usually the homeless coordinator at each medical center, we're cultivating those relationships to inquire if new agencies are interested. So it is a grant, so it has a grant cycle. It's usually late summer is when those grants come on board. So any agency that's interested, service agency, I should say, that's interested should be reaching out to their homeless coordinator about interest in participating. I just met with an agency here in Indianapolis called Coping and Healing who's interested. So we're gonna work with them to see if they'd like to pursue a grant. But again, I always try to be transparent. Grants and contracts with the government are heavy. So you do have to have some support to those agencies interested because it's a lot to navigate through. The National Grant and Per Diem Program can help with that as well. So I'd be happy to share some contacts
That'd be
for
great.
you and help you. Are you from Northern Indiana?
Allen County, Fort Wayne.
Yes. Unfortunately, yes. Those areas did lose some service providers. So let's get connected and I'll leave some information that can help you.
Thank you. Appreciate that.
So these are our transitional options. We also added an option this year with our community provider. As some of you may be familiar with Gennesaret. It is a community provider that supports what's called medical respite needs for veterans. This is something that's new. It's a pilot. We have one bed there. It's small because this is something we need to develop, but it's also, there's a lot of layers to contracting. So essentially what Gennesaret is providing to the veteran that's currently there is he's an older veteran that just had surgery and he needs time to recover, but he has nowhere to go after recovery. So not only does he get the support to recover from a needed surgery, but they're also going to help him with housing, the next step. And frankly, just to put it plainly, our veterans are aging. We're not doing enough. We're not keeping up with the amount of aging that we are seeing among veterans in order to address the homeless needs among what, I don't like this term, but I'm going to use it, our geriatric population. We're seeing more complexity among aging veterans, both medical, mental health, and particularly long-standing addiction issues. So this is something that if you get to talk to me outside of this, if I talk about expanding our aging services for homeless veterans, that is because we are in sore need of trying to find housing solutions for older veterans. Just an example, we've got veterans that are in their early 80s that are experiencing homelessness. We've seen some of that elevate and increase because of some of the complexities of housing in the last year, which is commonplace. Most people are aware of inflation. The price of housing has dramatically increased, affecting those that are on very fixed incomes. So our largest program is the HUD-VASH program, which that's kind of how we're identified here, but that is just one of our programs. The HUD-VASH program serves over 600 veterans in our catchment area. We're close to 700 now. This is our permanent housing program. It is also a very specific program to target veterans that are chronically homeless and have complex case management needs. So generally the folks that are in these programs have chronic homelessness, mental health, substance use, financial management issues. They struggle to remain housed for various reasons. We have a partnership, just like it said with HUD there, it's a Section 8 partnership here with IHA, Bloomington Housing Authority, Lafayette Housing Authority, throughout our catchment area for those veterans to have vouchers to subsidize their rent. And then it comes with case management. So the VA provides in-home services. So if you hear me talk about home visits, we're in their homes every week or every other week talking about how's your apartment going? Are you staying sober? How is your mental health? What do we need to connect you with? It might be a family where we're talking about making sure the kids are in school. How is everybody doing? So it's a very comprehensive and complex program. Frankly, we will probably continue to see that grow because it's also the most cost-effective program. It's much more cost-effective to provide a voucher support for a veteran going into a permanent solution versus our transitional options. That's a very high cost to spend versus helping somebody go right into a permanent solution. Our biggest challenge right now for Indianapolis and across the country is housing stock. Most of our veterans are single male veterans or single female veterans. And so one bedrooms are very, very competitive. If you can imagine a veteran that's experiencing homelessness that needs a voucher is competing with everybody else looking for a one-bedroom apartment in the community. So granted, we have to lean on our relationships. So we have very strong relationships in the community with landlords and apartment managers. GLIC, we have a very strong relationship with the GLIC Foundation in some of their apartments they provide. So we have a homeless primary care clinic here at 777. It operates on Tuesdays. We are a small clinic, but we are very fortunate. So this team, this is a physician, nurses, and a social worker. They see this team relationship to their homelessness, and we try to integrate the medical care with what they're receiving in the homeless programs that they're in. So I'm gonna look at my next slide here. Let's see, we also have the VA domiciliary. The domiciliary, most folks are really familiar with the domiciliary because it's been around forever, but it is one of the oldest healthcare programs. It also serves homeless veterans here in Indianapolis. We have a 50-bed domiciliary here that is up there at the Fort Bend location in Lawrence. It's beautiful. It is a wraparound residential treatment center for folks that are experiencing homelessness. So they have to have a wide array of needs. They also help with the next step into permanent housing. One of the luxuries that all of our veterans have, which I wish we would see more of, and I will continue to advocate for dental programming and dental services. But if you are in our programs for 60 days or longer, you have access to specific dental services. So unfortunately, though, if you're not willing to engage in one of our programs, you don't meet eligibility. And we do have veterans that are homeless that would prefer not to engage in our programs, but yet remain homeless. And so I'm hoping over time, they will understand that those veterans deserve that dental care too, even if they choose to stay outside. We have relationships with those veterans, so we respect their choice, but we still make sure we go out and see them. So there are a couple of adjunctive programs that I want to highlight. We have the Veterans Justice Program. This is a very comprehensive program, and I know I'm going over time, so I apologize.
Fine, go ahead.
Okay. When somebody said 15 to 20 minutes, I was like,
They didn't know you very well.
we're also people don't realize how large we are. So we have two programs that focus on the justice system of homelessness and justice issues for our veterans. We have a justice outreach program, and we have healthcare for reentry veterans. So yes, we go to jails and prisons throughout the state. I'm very proud of this program. We do phenomenal work with our veterans, particularly coming out of prison, jails as well. This is where you might hear about veterans treatment courts. So if any of you know Judge Serto, we are a guest in his court. We support all the courts. We have 9 in our catchment area, which is we have more courts than the majority of our counterparts in other states. So we also have a very robust relationship with Indiana Legal Services. And so they provide a formal partnership with us to make sure veterans have access to civil legal services. So I've included the legal clinic flyer in that packet that you were given. This packet here has the legal clinic flyer. This is a clinic we host every Tuesday like clockwork, second Tuesday of the month over at the hospital. Any veteran can come to it if they have civil legal issues. So driver's license, upgrades, custody issues, divorce issues, will issues, guardianship issues. You name it, they do it if it's civil. This is something we are required to provide, and they are spectacular partners, Indiana Legal Services. We also have vocational rehabilitation. There are some specific metrics that we have to have that target helping veterans find work that are homeless. That's integrated into these programs. We have CWT, which is our compensated work therapy program. We have some very specific programming with HVAF that's very, very successful. So lots of layers. We also work with the regional office for some of their educational benefits for our veterans. Last but not least, which again takes me back to the community because it's just so large, the community aspect. So several years ago, the VA started funding community-based grants for service providers called Supportive Services for Veterans and Families, otherwise known as SSVF. If you've heard that term, that is a program that's community-based. So they're receiving VA dollars to provide services to veterans closer to the community. So for example, we have a lot of resources here in the metropolis, right? Here in the metro. Transitional housing is only here in Marion County. I don't have it in Monroe County. So the VA did what I think is a very smart thing by making sure that agencies have access to dollars to help veterans that are homeless in rural communities get housed. So SSVF is phenomenal. There's a lot of dollars that have been tossed their way. So when it comes to rural veteran homelessness, this is the premier program that we refer to, and there are agencies throughout our catchment area that provide these services. So no matter where you're from, they have SSVF in the Fort Wayne areas as well. So SSVF is nationwide. I couldn't begin to list, but HVAF, HIP, Volunteers of America, Intercare, Lafayette Transitional Housing Center, Reach Services in Terre Haute. So we have services all over that we're involved with. And so the VA plays a hand in all of those programs as well. So I don't think I could go on and on, but I won't. I've included some important links, but that is our snapshot in a nutshell. The paperwork that I provided, again, is very important in terms of like, this is the resource guide. Make copies of it, give it to whomever you find. It's out there. We have it out on our second floor as well. I have a list of SSVF services. It's yours, copy it, give it to whomever, the legal clinic. And then I have an additional Word document snapshot on all of our services in case you want to take that with you, because we have a lot of programs and each program focuses very differently. So, Dennis.
So
So, you've been doing this for a long time and you know this area very well. As you think about this organization, this commission that of individuals who are not just oversee this agency, but are part of this community. What do you see as the greatest challenges for veteran homelessness in this community, the community that you cover and that you're not able to meet right now?
Yeah. Some of the challenge, I mean, there's a wide range. Our aging needs are probably some of our largest, just because some veterans can still live independently, but they need like a senior living environment to support them being independent. The access to senior living is very small in this community. So that's something we're going to continue to need and see grown. Our veterans see a lot of barriers related to their mental health and substance use. I'm not going to lie, but we have veterans with evictions, more than one eviction, sometimes more than 3 eviction. There's some behavioral challenges that we struggle with, and a lot of time, first of all, evictions are very hard to overcome in the state of Indiana. For those of you that are familiar, we have some very strict housing and tenancy laws here. So eviction is hard to overcome. It's very challenging to get folks to look past eviction. And we also have criminal histories that are part of that. And so educating folks to give people a second chance, sometimes a third chance, can be a challenge.
It's an interesting comment, especially since we're in legislative timeframe. Obviously, nothing's going to happen for this timeframe, but
Yes.
one thing I think I'd be interested in is getting a conversation with you of where some of those laws are at in Indiana. And then that can create some conversations around what are some priorities for how that might be looked at with our legislative partners to say, here's a potential solution or a change that would be good for veterans within this context. So I'll chat with you more on that to see if I can get kind of where those laws are impeding. We can talk with Polly Pollum over at Indiana Legal Services around that too.
Yes.
Because I think, that'd be a very interesting conversation to have around what legislation might be focused.
Yeah. And we know that there's some things out there happening, in my role. I don't want to delve into the legislative stuff, but we do know that there's things out there right now, that might give us some opportunities. So we watch that from afar.
Just point us in the direction that we can.
Yeah, absolutely.
Behind a federal wall that you got to be careful.
Yes. So, those are probably the housing stock is always a challenge, but that's so much larger than a veterans issue. That's a nationwide issue right now. And there's different things that I think the city has been talking about that are something we look forward to. There's some discussions about how to utilize our shelters better as well. A lot of veterans are, even my own self, it's not the greatest conversation when you're homeless to say, well, let's get you over to the shelter, right? Because most folks think in the VA that they're going to have something a little bit better than just the shelter to go to, but that's not necessarily the model, right? Shelters are a vital part of the community in terms of emergency solutions, but we struggle here with some of our shelters, some of the dynamics. The city has been talking a little bit more about different shelter opportunities, so that'll be good. I think we have a very strong relationship with Wheeler Mission and what they're doing. So seeing some improvements in our shelters over time, I think, increasing VA homeless programs. I know for me, I would really love to see some intentional growth related to female veterans, related to bed availability. The majority of our programs serve single male, and the female veteran is the largest growing demographic within VA healthcare. So about 30%.
Quick question. Do you ever attempt to place people in our home in Lafayette, in the Veterans Home in Lafayette?
Yeah, we do, as long as they meet
I know
criteria.
there's a lot of criteria.
There's
for it,
some
yeah.
criteria. They also have barriers related to legal background and things like that at the Lafayette Veterans Home. So, but yes, we've done placements there.
Okay.
I've worked with you quite a bit. I'm with the DAV state adjutant.
hopefully I'm doing a good job.
Yeah, HUD-VASH reaches out to us at the DAV to help with the deposit and sometimes the credit reporting and things like that. One of the obstacles, because not only do I work with your facility, but I also have Indianapolis, Louisville, Chicago. Part of the gap that we have is that when you all ask for the damage deposits, and you already know what I'm getting ready to say.
I'm ready.
We pay the damage deposit, and if we were able to, once that damage deposit is paid and the veteran meets the criteria, the damage deposit doesn't come back to us. It stays with somebody who never paid the damage deposit to start with. And if we are going to assist in a bigger picture, there needs to be an equitable way that where we could say that deposit is a good faith deposit on our part. If we're able to retain that and use it for following veterans, we could expand exponentially. Thank you.
Yes.
With the other surrounding facilities as well, but there seems to be a hiccup in the HUD-VASH program where they said we can't do that.
Yeah. I will say this has come up from time to time. It's always about some of those particular costs and how they're operated. So let's talk more about that. See if we can't tease some of that stuff out, because I know that that's a problem. So we've seen similar issues with the SSVF program that I talked about. We've got some similar hiccups related to sometimes when those deposits are provided and then not getting them returned or them being applied to somebody else. So I will say that is an art that we'll need to pick apart to figure out if there's a better solution, be more equitable.
And if there's a policy or something from a VA standpoint or rule or code that prevents something from happening the way we do, then let's talk about that so that I can take that conversation to the folks in DC on that, because there might be a policy change or might be something just, if it's a procedural policy, they can impact that pretty quickly.
Yeah.
Because we're talking $40,000 that if that is done, right, it could be, it's just like the housing program for home loans for veterans. When they pay their loan off, they get that credit back if they want to apply for another home.
Right.
Well, again, if we're able to do that, that nugget can be spread out to a much greater and help populate the homeless personnel into housing a little quicker.
I think some of the logistics of that has to do with tenancy, how the tenancy works when you provide a security deposit you're providing that to the apartment complex, right? Some of the tenancy rules related to how security deposits function, I have found has always been there, and that has a lot to do with tenancy laws here in Indiana and things like that. So
Stuff we can work. So I think.
Yep.
I need to learn more about the conversation, but I think that's something we can discuss and see whether it's state, local, federal kind of stuff that we need to challenge.
absolutely. Love it. Thank you.
If I could just throw in one thing, well, actually two things. What
Okay.
Kendall didn't mention is they are our neighbor here at 777. They occupy the whole second floor. So they're a happy neighbor of us. We were so happy. We moved in after COVID. We were here alone for a long time, and then they moved in and gave us somebody to see besides ourselves. The only other thing I just wanted to point out is on the veteran legal clinic, that is something that I go and volunteer every month for over at the VA with Indiana Legal Services. And Director Weimer lets me not be here for that day so we can go do that. And there are times that we'll have 40 veterans there. Of course, Indiana Legal Services would have the official numbers, but we start at 11 and then you have to sign in by 3 and then we go to 4. And I mean, people are lined up. And one of the interesting things is it's not just veterans from the community, but it'll be veterans who are employees over at Rowdebush, then come to the legal clinic and ask their legal questions. It's entirely free for them. And so I just wanted to kind of put a little meat on that,
Yeah.
we,
That-
it's,
And
it's,
that part,
it's one of the favorite parts of my job, no offense.
that part of what we do as well is expanding as well, because again, veterans justice programs are a part of homeless programs, and we see a lot of dual relationships there with homelessness and legal challenges. And so even with civil, I mean, we've got veterans that haven't been able to drive for 2 decades that now have driver's licenses. And these things can be a barrier to certain aspects of housing and homelessness, you know? And so we love the legal clinic. We love what we're doing for civil legal services. And that's a big part of homeless prevention that we do in the homeless programs as well. And we love having you.
I have a quick question about Veterans Court. Is your department, can you guys be a catalyst to get somebody that's in the community in touch with Veterans Court?
Yes.
Okay, and so is that statewide, or is that just kind of here in Indianapolis? Would that kind of go for each HUD-VASH department, where kind of communities or individuals coming in saying, hey, how do I be a part of Veterans Court? And we kind of say, do you have a lawyer? You need to talk to your attorney and see if you're eligible for that.
Some of that has to depend on the function of your program. So here, all of my staff are well versed in education. So my staff go out and talk to all different types of agencies. We get outreach from the jails. So frankly, it's just a matter of if a veteran expresses interest and they qualify for the veterans court in their area, because there are some criteria, each court looks a little different. We try to link them with their attorney to talk about the veterans court in order to start the process of being referred.
Perfect.
I would like to hope that other veterans justice programs are operating the same, but every place is a little bit different based on their staffing, catchment area dynamics. So.
Thank you, appreciate that.
Any other questions for Kendall? Thank you so much. I learned a lot today, and
Sorry it took more
I'm going to
time.
ask our VFW state commander if she would have you at one of our conferences to speak with. I think that would be very helpful to us. So.
Please, this is sort of a part of my job. Dennis gets to see me all the time. Most of the staff that are here, they get to see all of the staff moving and shaking outside of the building. So
Having Kendall and her staff here is one of the things that shows the value and benefit of this building, because there have been multiple times where we've went back and forth. I've got a meeting on my calendar on Friday for a veteran who is working with one of their staff, and he wants to talk. And so we're working back and forth to get all of his stuff done. And that dynamic wouldn't happen if we hadn't had this opportunity, frankly.
That was the purpose of this building to begin with.
Yep.
And if I could just throw another log on that fire, Lynn and I from the MFRF program went down and met with Kendall and her staff. Oh gosh, we were there for, I don't know, hour and a half, just going through the MFRF program and answering their questions. And it was just great, because then you know about it and know the ins and outs. And we love talking about it. So it was just great. We went down, sat in their conference room, and went through the MFRF program, each requirement at a time, and talked through it. So it was a really great opportunity.
Very good.
yeah, reach out if anybody needs me to come to their area or their agency. I'm happy to present. I will say, you know what? Here's the deal about business cards. I don't have any, and it's not because I don't deserve to have them, but I keep myself very busy. And so it's one of those things, it's always the last on my list and I never get to it. So I've got to get business cards, but I will make sure everybody has my email, and you can usually find me on the second floor. But I will say I am in the community a lot. That is my mission. Along with my staff, like I want to be out there with the veterans that are outside. I was telling a couple folks that the cold weather snap that happened, we've been out a lot since late last week and through the weekend. So if you've seen advertisements about IMPD has a homeless team, we've been out with them this weekend. We go out with the blended street outreach. So I've got staff out there now that are making sure veterans that want to come in can, and if they choose not to, that they have what they need if they choose to stay outside. That is a choice that some make, and that's okay. We will still work with them and help them get housed if they want to be, because they are just equally important. They don't have to agree to be in a program to work with us. So.
Thank you very much.
Copy of the PowerPoint, could you send that to us?
Yes.
Yep.
And I tried to include everything electronically so you could send it out. If you want to just add my email to it, so. But I do have to go because I want to check in on some of my folks out in the community. So thanks for having me.
Thank you.
Well,
for
thank you. Thank you. Very good. Very important.
I'm gonna leave that stuff on the back table and I'll just come up later. So take what you want.
We'll bring it downstairs.
All right.
before.
It's fine.
So we'll move into old business now, and we'll turn it over to Gabrielle to talk about our GBS program and how we're going to set up a scoring committee.
Yes, so,
And we got a couple other little pieces.
yeah,
in
we're
there.
gonna toss a couple.
Add a
other
couple other little
in,
things in
but
there too,
we
yeah.
know you're all flexible.
Yeah.
So as you all know, we do the GBS grant every year, the Grants for Veteran Services Grant. And what we have historically done is we put together a team of internal and external scorers. So we, for instance, the first year had a focus on homelessness. So we got someone from IHCDA to come and join us as a scorer to bring their homelessness expertise to our scoring panel. So one of the things that we've been talking to Chairman Lear, sorry, I guess we used to call you Richard, it's hard to say.
It's okay with me.
Was if a commissioner from here would be interested in joining our GVS scoring panel. We do it one time a year because the grants are a year long, so this would not be a commitment that you'd be signing up for every month or anything like that. We do it once a year. We block off 2 days on the calendar to do it, just because we don't know how many we'll get, and we don't know how much Joe and I are going to fight over the applicants, because Joe and I like to fight about them. Yeah, yes, yes, we're both from New Jersey, so we will fight to the death. And so we encourage that discussion. And so we brought this forward today to see if there was any commissioner who would be interested in being on that scoring panel.
Can you describe who we currently try to have on the panel?
Oh, in our last scoring session, we had myself, Tim Winslow, Joe, Tony was there, Brooklyn Deaton, who is our grant and compliance administrator. She works on my team, was there. We never invite Dennis because we leave him out of the process, because a lot of times people will engage him and want to know things. That gives him plausible deniability that he was not on the scoring panel. He signs the award letters in his capacity as director, but he does not actively participate in that scoring. We've had a lovely woman named Rachel, whose last name is escaping me. Goodspeed, thank you, who has been joining us now for a couple of years. She does grant selection, grant application work, and so her expertise is in the grant process. Also, she brings to our panel an expertise in what grants are paying and not paying currently, because one of the things we try to do is fill the gap. So if the grant trend is we'll pay for direct services but not personnel, then we try to use that information from her to shape our decisions, because we all know you can't run a successful program if you don't have any personnel there to run it. We also have had someone many years, all the years now, from MFRI at Purdue, and then they bring that expertise that they have with the military community, and of course, any data points that they have as well.
Not all of those people score though, so correct?
Correct. Tony usually does not score and Brooklyn does not score. They provide an administrative function to us. They make sure all the scores have the applications, have everything that we need in order to score. They run the background criteria. In essence, one of the criteria is you have to be registered with the Indiana Secretary of State. That's just Indiana law. So they'll do those searches and make sure that we're not scoring someone that doesn't meet the basic criteria.
Yeah, so we like to keep an extra group of external folks in doing scoring. The agency still has the majority, 3 out of 5 that score, but it really provides some great external perspective to the different thoughts. We still maintain the responsibility for the decision. So this would put a 6th person kind of on the scoring, which would be great. So just, I wanted to make sure you guys knew the additional people that were already on the scorings. So no, it's not just the leadership team or 3 people from the agency kind of deciding. We get other inputs also. And that's been something we initiated from the beginning, was to have that external added perspective. And so having an additional person from the commission would be a great thing.
Right.
And something that would be, easily workable as long as someone would be amenable.
How many applications are you typically looking at each year?
I'd say the average, because it goes up and down, I'd say on average, maybe 25 to 30.
Highest has been 80-ish.
But then we've had lows.
Most has been like 15 or 16. So yeah.
Yeah, so typically, maybe if you get 30, how many are not qualified when you go through the qualification at all? And then the amount that you end up having to actually review.
I think could probably say that easily the first 10%.
Not qualified.
Yeah, and like Gabrielle said, being registered as a not-profit in the state of Indiana, serving veterans in the state of Indiana. Those are major criteria that oftentimes I think sometimes they can't, if they're not specific in the grant, prove their service.
Okay.
And even for the ones that pass the first hurdle criteria, there are always some that are a quick, you realize that that's not ones that meet the purpose areas, because there's 6 purpose areas set forth in the Indiana code that grant money can only go to the purpose areas. So even though they might make it past the first hurdle, the first thing we always do is say, okay, which ones are people's identified? No, because
So-
they don't meet the purpose. areas.
Are these the grants that the VSOs also get?
No, this is just the GVS program.
So is any commissioner willing to volunteer, or do we need to twist somebody's arm? Kevin?
I can volunteer.
Okay, very good. Anybody else interested?
And we can,
Always get it down to
I don't know if we need a commitment now. What we can do is when we set up the discussion, we can send out the request and ask if there would be a commissioner that would be willing for these days. Because some of it depends upon if you volunteer now and then all of a sudden you're on vacation, kind of, that is like.
Yeah, we can always
can't do
backfill.
this. Yeah, so if the commission is interested, I think it's just we can take a vote if the commission is interested, and then we'll include that in our process.
Well, we can take a quick vote if somebody make a motion that we should put a commissioner on the GVS grant scoring committee. I'd like to have a motion on that.
I'll make a motion to have a commissioner on that committee.
Thank you. A second?
Second.
Any discussion? Any discussion? Any discussion? All in favor, say aye.
Aye.
Opposed? Carries.
Right, the item that we added came out of our most recent MFRF task force meeting. As you all know, we have the stipulations that we add often to awards: financial counseling, meaningful engagement with the Department of Workforce Development, and meaningful engagement with the
Legal
CVSO.
soap receipts?
The CVSO.
CVSO?
Sorry.
You're okay.
So the way we are currently handling it, per the task force's wishes, is if a veteran has a disability rating of 100%, then we do not add the stipulation to see their CVSO. But if they're anything under 100%, then we do add the stipulation to engage with their CVSO. So we had a dialogue at the last task force meeting that we all said, let's bring that forward today, is should we be referring, we being all of you, referring veterans, even if they're 100%, to their CVSO, because even though they might be 100%, there might be other things that they don't know about that a CVSO could educate them on, such as the tuition and fee exemption program, other MFRF, other resources that just because you're 100%, you may still need or want to know about.
Yeah, because like Joe said, there are other services out there other than just your disability benefits. I mean, there are homeless services that they may not be aware of and things that the CVSO should be aware of. So I think it would be a good thing to add that no matter what their disability rating is, add their contact with the CVSO.
And I'll throw one more piece of information from the discussion. Currently, we put it as a stipulation that it's a mandatory item they need to do before they receive a future award. What we then talked about was for those who are 100%, would it just be a referral versus a stipulation that if Richard was 100%, we would say, we recommend you go to your CVSO to learn about other programs. But if he did not complete that, it would not be a bar to him receiving a future MFRF award like a stipulation. Yes, sir.
I think the stipulation should be for things like the financial counseling. But as far as engagement with the County Veteran Service Office or any other type of outlet similar to that, should be more of a deferral. Personal needs over the individual and their personal circumstances do vary greatly. There could be reasons they aren't looking to engage in that avenue. So I think a possible referral to them, but the stipulation should be for the things that are impacting them that they can engage with, like financial counseling.
So at under 100%, there is the potential for that engagement. And then that if many are at 20, 0, 30, whatever. So we currently stipulate that they then need to engage with their CVSO. Because that quite often can impact their financial standing. So is your point that at the 100% level, it's a referral, but we keep doing what we were doing beforehand, below the 100% level, because below it, it is a stipulation.
Right. I think that at 100%, it should be more of a referral.
Okay, I just want to make sure I was clear. Thanks.
Because in some cases, even though we think on the surface something would look good for a veteran to maybe engage to look to see if getting a increase in their compensation, there could be extenuating circumstances that could negatively affect them if they do reapply to have an evaluation done to increase their service connection, that the possibility the VA could turn around and decrease is possible as well.
And that's one of the reasons we don't stipulate an action outside of it. So it's go engage, make sure you're connected and engaging with your CVSO, but we're not stipulating that you have to then engage with a specific defined action,
Right.
because you're exactly right. It's just the conversation. We want to make sure that they know who their CVSO is, and that because quite often there are other resources in that community that may be accessible for that person, completely outside of our MFRFs. Yeah, that's right.
And I think I would make the argument that even though you are 100% permanent and total or not permanent total, that you should be seen by a veteran service officer. I feel there's an opportunity there to talk about life. If that's looking at, are you accessing your healthcare? Are you following through with everything that the MFRF? I just think that's a good touch point. I see too many service members that are 100% individual unemployability, so they are only eligible for a certain amount. They still need other resources that could help them kind of get by. And so that's kind of just my caveat. And I would like to capture them. I think of that TDIU, individual employability individual. He may be one service connection away from being 100% permanent and total. And then it's kind of that weight is lifted off of him or her. So I guess I just see a lot of areas where we could kind of connect and touch points. So
I think your champion is not 2 weeks, it's CSL for 100% service connected as well. Yeah, even a lot of veterans who are 100% better coverage, we can reevaluate their understand that. There's a lot of reasons for 100% veteran engaged as well.
And Kevin brings it, thank you for that. Kevin brings up a really good point and a scary point where a service member may file for an increase when it may not be best served that they do file for an increase, and that could jeopardize their service-connected disability. And I think that is, to the district service officer's point of they need to be kind of talking to their service officers, making sure that they know how to follow through with that. So I hear you, and that is scary. It really is. But I would lean towards their support to be able to make sure they're doing the right thing and to be able to give them that counseling.
One argument for it to be stipulated. People don't do things unless there's a requirement. And so from a referral standpoint, I don't expect too much activity. And people don't do the stipulation until they come back for more dollars, then say, you can't get any more dollars until you go do these things. And then they go do them, and we're fine with that. So and some of it is to drive behavior. You know, so we believe that behavior, that interaction is positive and has benefits for them for many other reasons. And so the reason to stipulate it would be that it then becomes a mandate if they need more funds. And so that would be one reason to, at whatever level, to provide it as a stipulation for future dollars. But with also though that if they come in, they haven't done those things, what we are doing is they just have to go do them, you know, and then it's okay. Now let's get you through. So it is it's one way to help encourage things, not encourage, but require things to happen. Because we just don't see things happening unless it's a stipulated referral, and it really is on the back end that we see the activity quite often. Is that Tim, is that a fair statement? Okay, so Tim sees all of the paperwork and documents, so that'd be one reason. I get the other reason for not making it a stipulation also, and I'm fine with either path. I just wanted to throw that as a rationale for making it a requirement.
Well, we've seen the statistics that when veterans are engaged with the county veteran service officer, that the quality of life for that veteran, if they stay engaged, is dramatically improved, not only just because of the resources that's provided by the county veteran service, but for information to the family of the veteran themselves as well. It not only provides them an ability to look at compensation increases, but education, housing, the different avenues, life insurance, the different things that are available, and even the homelessness, which Kendall was hitting on, they could be the direct connect for that homeless within the 92 counties within the state. So the statistics show there's nothing but positive, but there's always that percentage that can have a negative being from it.
So, Joe, just how many veterans actually, when they apply to have their service-connected disability upgrade, how many actually, I mean, is there a percentage or that you can tell me that get downgraded, or is it just happenstance? Or
I can't share with you a percentage who gets downgraded. I think that kind of goes on the office to ensure that they know what they're getting themselves into. And so they're reviewing why they're at that percentage. They need to review where they think that they are. And so I think that's kind of the catch in the office part of ensuring that they know what they're doing. So they're moving forward on their own if they want to do that. So I can't
you're
really
not
give you a
twisting their arm. You're wanting them to make up.
we want to hear that they want to do an increase because that gives us the opportunity to kind of expand on that of how that can be a life-changing.
Yeah.
So I think we're in agreement. It's a positive experience. It can be. So the question is, do we mandate it or do we not? I think that's the question for at that 100% level. You know, just make it a mandate, a stipulation requirement for them to get other funds, or do we make it a referral at that 100% level?
I'll entertain a motion from the floor.
I'll make a motion to make it a stipulation that they are seen by a CVSO, even if they're 100%.
Have a second on that motion?
Second.
Thank you, sir. Any further discussion? Any other discussion? Any other discussion?
And feel free to vote your mind.
That's absolutely.
This is not
Yeah,
a,
we don't
we're not
vote as a
100%
group.
process. here.
We've shown that over the last
Yeah,
few
yeah,
years.
that's a
We
fair
don't vote
point.
as a group. Yes, we do. All in favor of the motion to stipulate even 100% disabled veterans need to visit their county veteran service officer, say aye.
Aye.
Opposed? Motion carries.
Could I ask one clarifying question? Would this apply just to those that you see with the task force?
No, I think all of them.
Or
We didn't qualify anybody.
I just wanted to,
Right,
Whenever we provide a stipulation.
right.
Yeah.
Yep. Okay, moving on. We're still with Gabrielle. She's going to talk about rules, military family relief rule update,
yes.
which we just did. We just added a new one.
So, and that, so it's actually already covered in here, so.
Excuse me, I swear.
So you've seen the amended rule probably about a year ago, and we started the rule amendment process. And then a House bill came out that then changed the dynamic to rules and agency rules. And in a nutshell, what the House bill did is that if something is not in the Indiana code or the Indiana administrative code, which is the rule, then an agency cannot legally enforce it. If they do enforce it, then the individual who has had that enforced upon them could go and get a private attorney, sue the agency, sue the state. And if they're victorious, then the agency would be responsible for the legal fees of that individual. So that put us back to the drawing board on the MFRF rule. And so we've spent the last few months, myself, Tim, and the MFRF team have been going through the rule over and over and over again to make sure that we're capturing in it every denial reason, the stipulations, the referrals, everything that touches the MFR program is now contained in the rule. So I know you all got it as a pre-read. I'm gonna not go through it change by change. I'd be happy to entertain any specific questions. And then ultimately we would need a motion and a vote in order to move this forward to the first step of the process in order to get the amended rule moving along the pipe.
I'll make a comment because I met with one of Denny's compatriots yesterday. I met with Mr. Bartels and he said that rulemaking is easy now. He says it's a very quick process.
Yeah.
And I said,
We're gonna test.
I'm going to test you.
I'll let him know where that stands.
He assured me it's a quick, easy process now. As long as the agency follows through.
Yeah. They streamlined some of the process steps, but there's still, the challenge is when there's a backlog, there's a backlog.
Yeah.
And every agency has had, we are a small agency with one or two rules. There are agencies with dozens and dozens that had to be redone and completely. And so there's a lot of work going on right now, a lot of process. When that happens, you get things take time. And so I would say we're not to a point where we're under the year timeframe that it was before yet. Doesn't mean it may not get there. It just means that there's a lot of work going on now with the change that was made.
Okay.
So we're not at that point where it's smooth as butter yet.
I didn't believe we were.
I'm glad to hear that. I'll talk with him this.
Yeah, you know him well. So we all know Mr. Bartels
Yeah.
well.
I do have a question. On the draft that we're looking at here, the stricken ones are the ones that have been changed, correct?
Right, the strike through language is the old language that we would like gotten rid of. The language that is in bold, which I know is a little challenging on the photocopy, is new language. And to address our conversation that we just had about the stipulations, on the bottom of page 10 is a whole brand new section on stipulations and conditions. And the dialogue that we just had would not affect that language. That language was drafted broad enough that the dialogue we just had would be inclusive of that.
And we're not looking for a vote today, correct? Or where we
We
voting?
are,
We have-
yeah, without a vote, I
We have-
can't get it into the
Can't go for
pipeline.
it.
Thank you. That's what Jack's making sure.
So again, I'll entertain a motion from the floor.
Second.
Motion to approve. We got a second. Any discussion on the draft of the rules that we plan on presenting to the state?
There will be public meetings on this, so there's still opportunity to engage. And so don't, if with this approval, it's to move forward.
Right.
If there's some comments, then we need to have those soon, but there will also be public comment coming up on them. So
Yeah, well, there's always public comment.
Yeah.
Always.
Always.
What was the benefit of the House bill that changed that allowed that?
I don't know that I saw that bill like that. It must have been one of those that I didn't
I'll
look
give
at.
you a sidebar kind of thing. It's just that some of it came out of the coronavirus executive orders discussions and issues around what executive agencies' authorities are. And so the legislature put some wrapping around some of that. And I think, and so it came out of that discussion, and some of that is around, what authority doesn't, so there, for example, that I've heard from a legislator was the Department of Health requiring things in their area, and what do they know better than anybody else? And so they were making things required as law, and you can't do this without this, you can't do this without that, under just their activity as an executive entity. And so that was some of the discussion, but actually, I don't know if you remember the bill, sir, but that came out last year, but around really a lot of it from my discussions with different folks came out of some of that kind of that activity, and then the desire by some of the legislature to put some controls on that. And so so the outcome of that is, as executive agencies, we have to either put it into a bill or put it into administrative rule, or we can't do it, which the only is personal as days. The problem is that really creates difficulties from a flexibility standpoint and the ability to meet our customers' needs where they're at versus meeting them where we're at. So that's why their intent was to streamline it. We'll see how that streamlining goes. But because to do so say we have to do something different, to do that differently, we have to now go back to the administrative rule process and then do another administrative rule. No matter how long that takes, that's going to be problematic. That's just, so my hypothesis on this is there'll be things that will at some point say we cannot do because of the way that is set up.
Well, we in the legislature naively thought that we had some input on some of these executive committees. It wasn't just pointing out the VA.
Yep.
All of a sudden we're saying, say what? They're doing what?
Yep.
And it's not exactly what we had in mind. I think we find it easy to work with cartels.
Oh, yeah.
Oh, yeah.
Well, if we need to change law, the lawmaking process has been great. I've had tons of enjoyment in it and challenges, but in having those discussions and debates, it's just a time thing. And so, we'll see how it happens, how it goes, but we'll work with it fully. And that's what we're doing right now.
Yep.
Our
We
job
have-
is to implement against what the laws and rules are, not to make them up.
We
on
don't
our own.
write rules. Yeah, well, don't like laws. We write rules. So make
We're
them
a
get over it.
benevolent dictator and I'll take care of all of it.
All right, we have a first and a
A
second.
And
And we have
discussion.
discussion.
All in favor, say aye.
Aye.
Opposed? Motion carries.
And then I'll update you, as I've done in the past, on our other rules at the meetings. I'll give you an update on we're at this step, that step, and so you'll be fully in the loop.
Yeah, especially when public comment comes up, we'll be doing
Oh,
that in
absolutely.
the in-between times too.
And we'll now turn it over to Director Weimer and Mr. DeVito to give us our annual report and let them know that we're already 10 minutes past their time they were supposed to be finished. But we don't have any appeals
No, we
today,
have no
so we should be good, but legislative update may take hours.
And I don't see public comment, so
See anyone who's
I'll turn it over to Joe and let Joe go.
All right, so we won't go through it page by page. I know that might be disappointing to some, but everybody got it on a pre-read, and I believe, I don't know if the link was sent. We can send anybody a link to our online booklet as well, so you can kind of look through it that way. It's the same format we've used in the past few years of the annual report. You see, as you go through it, we got a few basic numbers that we get supplied from MFRI, one of our great partners, about Indiana and some of our populations. Then we kind of look at our staffing, and then we go through each division one by one and give some.
It's a short-haired picture of you, man. You got-
It's getting old. I probably should replace it.
Yeah.
I know, and I don't have that hair color anymore, so
We're gonna,
updated photo. I appreciate
so
it.
Salon, take a note. We're gonna update some photographs.
Remember? Yeah, I already called.
Right on. We do reflect the staffing in the booklet at the time we made it. So this is the last fiscal year, which goes up to June 30th. This past June 30th was the end of the fiscal year 2023. That's what this covers. So we go through division by division and give some important data points for each part, including our cemetery and our home. You can go through that and see it as you go. I do want to take a quick opportunity to let you know, if you saw in your pre-reads for this meeting, we have a little bit different format for the data from each division reports that we're submitting. Wanted to change up the format, have a sad goodbye to my awesome graphic pages I did for you guys. But what we realized was when we have our division data reported for the purposes of the commission meetings, which then culminates in the annual report, we wanted to present it to you in a way where you can kind of see it build throughout the year. So if you got the pre-reads this year, it's a spreadsheet and it has each division and all of our data points. You'll see it has the 3 months and then a total. That's so you can see where we're at this point. Next commission meeting, you guys will see the one total, and then you'll see the next 3 months of the second quarter in those totals. So you can start seeing throughout the year the accumulation of those data points instead of just getting that quarterly snapshot. So you can see throughout the year, and then the fourth quarter will culminate with an annual report. But that's all the time I feel I should take up while you guys thumb through this. Any questions?
Comment more than a question. This is not meant to sound self-serving to my team, but as a kudos to the commissioners that serve on the MFRF task force. On page 9 is our legal and legislative page. And in FY 23, which is what this covers, you considered 156 over 25 requests for almost $300,000. So I just wanted to point that out, that all those times that you make the time in your schedules to come and have those meetings, that over the course of 12 months is what that means to the veteran community. We did not include the other than honorables in this, but we have that data as well. But I just want to take a moment to let that number sink in for those of you who do. Answer Kelly's emails of the, please, can you meet for a task force, and squeeze those into your schedule. So that number just was very impactful to me and my team. So I just wanted to highlight that to you.
And put it in perspective, that's more than we gave out 2 years ago for the year,
Mhm.
in total, 3 years.
And to that point too, if, as you do, please look through it, because you can see division by division, all the extremely great work that's happening here. And you can see just, all the way down, training and services, our accredited CVSOs, that partnership is growing and growing. And you can see, all the different divisions, just the hard work that's happening on a daily basis. And it's all laid out in here. And if you have any questions in the future on this down the road, you can always hit me up with an email as well.
I just have a quick one on the accredited accredited CVSOs. Are we up to 100% now? I know you're very close. You're 99 here and
It's
89 with veteran expect accounts. And this I know was, so happy.
September, it was 92.
Yep. Oh, I didn't pull up that.
September, it was 92. July 92, then we dropped down.
I know we've
by-
been growing, yeah.
We had a couple replacements.
Yeah.
Yeah, and then back up to 92. So that's for that quarter. So Tim and Phil and Tim's team have been just working very hard on that to keep that at 92.
Good. Yeah, very good. Thank you. I just saw that on the sheet there, so. Any other questions on the annual report?
just like to make an observation that you see on page 2 where the guy who's VA director, his name is Dennis, and secretary, if you look at part of Veterans Affairs, his name is Dennis. There's some kind of connection there because Dennis is a good name.
Dennis, I'm not
Yes.
sure. What's going on.
I think that's what that
From the other person named Dennis in the room.
Yeah, exactly.
We have to say a few chairs away from each other or combust.
Yeah, get confused. Yeah. Any other questions? Comments?
Joe's done
Very
such
good
a great
report, sir.
job and the team have done such a great job
Fabulous.
on the visualization of this annual report and the content. If you want to have fun, look back at 5 years ago. It looks dramatically different. And I think it's a much better representation. And you can see the evolution of it over the last 5 years of how it's evolved. And so thank you very much and kudos for that.
And the members that have been on the commission for multiple years, and I'm not one of the senior members, but some of the senior members on the commission have seen the change in this department over the past few years since you've been the director and your great staff that you put together. And we do appreciate it very much.
through.
Yeah,
Yeah.
still push through.
Still.
It's
It is
totally different.
mind-boggling,
It's
isn't
a
it?
totally different agency than what it was years ago, without a doubt. So, and we all appreciate that.
Kudos to the team.
Yes,
you.
thank you
Job
very
well
much.
done. And I would say the same thing about the commissioning. Kudos to all of you as well. It's a much different thing and the partnership is great. Lastly, is that we would like to publish this on our website and send it off to some other folks. So does the commission vote to approve the annual report?
I'll ask the executive director.
Is that? Let's just do it because
Yeah,
we
might-
can't be wrong. Let's
That's
do it.
right.
Go.
I'll entertain a motion to publish this.
I'll make a motion to publish it.
I'll second
I
it.
got a second? We got a second? Any discussion? Any discussion? Any discussion?
The motion approve and publish. That's
Right,
kinda what I-
approve and publish.
That's what I said.
Oh, yeah, sorry, I didn't hear you.
He seconded it? Yeah. All in favor, say aye. Aye. Any opposed? Motion carries.
All right, thank you.
Thank you. Great job. All right, where are we up to?
There are no.
Tuition and,
There
no,
are none.
and for the first time in a couple of years, legislative update that doesn't involve my name.
We figured you'd jump in.
I probably will.
I suspected you.
Get my little sheet of paper out.
Oh, thank you, sir.
Not that you need.
So,
You're welcome.
Thank you.
Okay. I'm Anthony Weber, the Legal and Legislative Deputy Director. And so the handout that I just passed around, one for you, sir. Didn't mean to
You have
miss.
a next one?
I do.
Thank
Yeah,
you.
Rick, sorry. Oh, sorry, sir. So the way that we are looking at bills this year is a little bit different, obviously, since it's not a budget year. But we're tracking anything that has veteran or military in it is going to be on my radar. And then these are some of the bills that we are specifically looking at. So our agency bills there at the top, HB 1202. I won't read through everything and bore everybody on all of the language of the bills, but essentially what we are trying to do is make some changes to the Military Family Relief Fund, make some changes to our GBS program, and all of the changes would involve areas that we've seen and need that needs to be addressed.
I want
Yes.
to highlight the first one. So Military Family Relief Fund increase the max amount from 2,500 to 3,500. And then add in there that the commission, so this impacts you, would have the ability to approve increases based upon the cost of living increases that are put up by the VA. So and the why 3,500, when you look at when 2,500 was spent or was hit, you then take cost of living increases and it gets you roughly to 3,500 to today. So it's as good a number as any, frankly, but that it gives some math behind it. And then allows the commission to look at it and go, where are our dollars at? Where's our spend? and what's that look like? And let's set the appropriate amount for our future years. Hopefully to reduce some of the meetings that are over 2,500, 3,500, whatever it will be. So that we can, move with the economy as it goes and move with the needs as they grow.
And so we also are, as I said, we're asking for some changes to our GVS program. Let me just break away from here and more anecdotally, the GVS program does, amazing things. We've already talked about that. But I think one of the things that we are trying to address here is the family of the veteran, the caregiver of the veteran who may not be aware of certain programs like you guys were talking about with the CVSOs. Also, when we are using these nonprofits throughout the state of Indiana to care for the veterans in their community, their hands are sometimes tied when it comes to caring for those who have full-time caregivers or their family members. Does that? Yeah, okay. The bottom portion of that bill, which is talking about the National Guard and school years, that is something that we've talked to them about, and it was added into to our bill, and yeah.
Representative Bartel, Mark and I and several other members of the Big Four met with Representative Bartels yesterday, and he asked us to very strongly support that bill. Of course, we will. The Big Four, that being the Big Four, not the commissioners.
Yep.
He explained the reasons for that, and he's very passionate about that because he really believes that's hurting recruiting of the Guard in all phases of their recruiting, because they can't get the juniors to go to basic before they get to a senior in high school. So the Big Four will support that. We'll vote on it tomorrow, but I don't see any problem with us supporting it.
So I've heard three arguments to things in the bill, and so let me just hit those real quick. The first one is there's a component here, Tony hit a little bit, where we add in uniform service in language in here. So there's the armed services, and then there's the uniform services, and which include the Surgeon General, Oceanic, and NOAA, and some other very small entities. So the argument was not that we were putting them in there. The argument was, why aren't you putting them everywhere? It's only in one or two. And the reason is, I don't know actually how large it is and what's the impact. And we want to test, and we do have great ability to modify. And so let's take a look and add uniform services into an important part, but then not put it everywhere in Indiana code yet, because it still requires that person has to have went to the VA and received disability, which they can do. They're eligible for. So, but right now we say armed services, and so we eliminate. They then may not be eligible for a benefit if the VA has deemed them eligible for disability. So we wanted to see. It's been something that's been on the national level, and many states have incorporated it. But I didn't feel overly comfortable throwing it into every piece of code that's out there yet. I wanted to put it into a couple and see what we see the impact is, so that we could have a better understanding of the impact. So that was number one of why isn't it more places? I think that's a very valid question, and if they want to make it more places, we can work that now. But I think it also is prudent to look and see actually what it is. The second argument is about the 2,500, 3,500. The group that and this is Military Veterans Coalition comments. They would and there's a couple of bills out there that they've been putting out around removing the cap on the 2 times poverty level. And so what that would mean is that anybody would be eligible if they have a financial need. So if you make $150,000 and you've made bad decisions and you save no money, and you have a problem at your house that you can't pay your rent, that's a financial need, and you don't have money in your savings account, you would be eligible. I'm not overly in favor of that. You know, this is for our veterans who are in need and both from a financial standpoint, so we can move them up. But you know, because the other one of the things someone said to me once on this outside of our agency was, you know, those folks that make larger amounts of money have access to other capital tools and borrow money, whereas someone who is below poverty level or below that has a really hard time borrowing and getting any money. Whereas if you have funds, usually you can be able to utilize other means to meet your emergency need. And it is what it is. So, you know, I would, and I'm open for any debates on that because I may not be right. Open for good conversation.
Well, you can always sell an asset. I mean, you know,
Yep.
people who've made that kind of money and not spend it wisely probably have assets that they can sell.
Yep. So, so that was the second one. And then the third one just left my head.
Some modifications to the code. Oh, sorry.
No, go ahead. Keep going. It's left my
One of
head.
them that we didn't talk about was some modifications to the code regarding eligibility to go to the veterans home. And
Yeah, that was
that's
discussed.
just to increase eligibility and to, you know, have more residents at the home.
Yeah.
The third argument was, dependents and caregivers that Tony touched. So we're working to have a conversation with the Military Veterans Coalition. The bill will be heard on Monday at 10:30. Yes, sir. And we'll see whether we can discuss it with them. And the way that Tony expressed it well, but when our veterans receive services in organizations, those organizations, quite often there's family issues, things that they need to be worked with their caregivers or others. And if they can't engage with funding to be able to do some things for that family, that might not be solely for the veteran, but it's for that unit. Because when we leave the military, our unit now is our family. And the Governor's Challenge title is the Governor's Challenge to Prevent Suicide Among Military Veterans and Their Families. And so without that family language, what we see is that our Governor's Challenge activities may be limited. And so and if you look at Senator Dole's whole foundation is around caregivers and the limited resources and support for caregivers of our veterans. So this language is in response to that, to be able to provide, really actually be able to implement the Governor's Challenge better. And so those are the three arguments against. We're going to try to communicate with the folks to be able to, so that hopefully on Monday, they're not coming in and going negatively because they just haven't heard and they haven't contacted us on it, but we're reaching out to them on it. So.
And if I may, I know a lot of you do legislative work. One of the things that in dialogue that I've had over our bill is there's a confusion regarding wanting to expand that eligible person to receive GVS funding, and that definition is going into the MFRF. And so I've had multiple conversations with individuals where they are reading it that definition of eligible person, including those other individuals, is an expansion to the MFRF program. And then I've been able to hopefully successfully make them understand that, no, that has to do with our Grants for Veteran Services program, where we grant that money to a nonprofit organization. We're just allowing more flexibility of that nonprofit to spend those funds. This would not have any impact on the fiscal aspect of the Grants for Veteran Services program. We would still be granting out the same amount of money. It's just allowing those nonprofits greater flexibility. So I just wanted to bring that up, as I know a lot of you have dialogues with veteran advocates over at the State House. And so I just wanted to arm you with, there is a confusion out there regarding GVS and MFRF.
Never happens.
No confusion in the legislation.
No,
I think I know one of the people.
On
sending it to you telepathically.
on one of the bill that we talked to Representative Bartels on, and the Big Four is going to make it an emphasis to talk to as many representatives as we can, including you, Mr. Zent, Representative Zent, is 1170. We'd like to we'd like to see if we can get that heard in education. Right now, it's not on his docket, but we'd love to get that heard. And we'd love to see some other co-authors on that because it is written or authored by a Democrat, but we'd like to see some Republican co-authors on that. And we talked to Bartels about it. He agreed to read it at least. And we'd like for you to do the same thing, Mr. Zen, if you would. We would love to see that bill passed because 1170, what it's going to do is reverse back to where we were on disabled children, children of disabled veterans being able to get complete tuition remission, not based upon their
Rating plus.
rating plus 20%. You know, we did that in 2011 or whatever, and it's had 2 classes of veterans ever since then, and we'd like to get rid of that language. And that's what 1170 does. It just wipes that language out.
Representative Gaines' sons have duty with fire.
The challenge is that, you know, education is busy. The education committee is busy. And so the bill, yeah.
Short session.
Right. So it's less of I think it's less of a challenge of interest. It's more of a challenge of just time and practicality of time. And so any influence that we can, or any help, questions, comments, it just needs some help.
Yeah.
Other questions on any other legislative bills or any inputs of where the agency is discussing any of them? There's the poster one that's out there.
Two.
Two.
One in the Senate, one in the
It's
House.
Same thing, but
Yeah.
yeah, we're we're neutral on it. We'll implement it. We talked to DOL, Indiana Department of Labor, and we'll implement again if that gets passed. So no big deal.
There's another one here that mentioned, it's probably not particular. 1214, the author is set right here.
Yeah.
And,
Yeah.
that is a compact bill, and if you're active duty military, you're, it's dental compact.
Oh,
yeah.
And you go to a state that's part of that, and Indiana is hoping to be part of that. Your spouse or yourself don't pay the fees or you pay the magnet fee because licensure, usually somebody's paying for something all the time. In my time frame, when I was back here, in specialty training, I could make far more of a part-time job than the Air Force. But, that we kind of tweaked that bill that people could be. And I think there's a lot of motivation right now. We heard Speaker Houston talk yesterday and what the taxes and everything else. We just need to keep going because Texas #1, Florida is #2. We got to catch up. Not just like Florida.
Yeah. Well, the Big Four is having a meeting tomorrow, and we're probably going to go through majority of these bills and decide which one as a Big Four we can support. I don't know of any of them that one or two maybe that we want, but most of them we will support.
make sure we add 1214 onto our.
Yeah, it's on this. Well, it's on the list that I gave you.
And I'm keeping this.
Yeah, that's my most updated list. I sent it to Tony earlier. But
Yes.
Any other comments on legislation? So
Well, every Friday, I'm going to ask Tony to send this to all of you. So you'll have this every Friday from here on out for the
I
commissioners.
should see it too.
Yep.
because I can't track all.
So we'll make sure we add all of the things that you're tracking on there.
right.
Make sure that list is equal. And so if you have anything that you see that you want to add on, just reach out to Tony and say, hey, pop on this one. And so we can add it into that discussion.
Okay.
Richard and I had a conversation. I'm sorry, Chairman Lear and I had a conversation yesterday and we're on the same page.
We're on the same
I got
page.
you,
Yeah,
sir.
we are. I see no public in the room, so I don't assume any public's online. So we have no public comment. Public comment? I don't see any. Director's report.
And it gets us
Mr.
5 minutes
Weimer.
ahead of time.
Oh, wow. See, well, I rushed right through that so you can talk after.
It's like we've done this before.
Let me, I got a couple things I wanted to raise. For one of the first times that I've been here, we're pretty much fully staffed and have been fully staffed for a while. Which brings challenges to our budget because I've always been going, well, we're never fully staffed. Well, now we're fully staffed. And so Tim and I Tim's not playing here out. He doesn't have much left, but I don't have much left either. So we're, talking through the budget issues.
Don't have enough.
There you go. Talking through the budget issues that implies, but it's a good thing. We aren't, people aren't leaving because they, I can say that everyone that I work with here has amazing passion for this work, and that brings me, great joy that they're happy to be here and continue to do the work as we work to continue to improve what we do with them, for them, through them, and for all of our veterans. One person, we have a brand new staff that started yesterday. Leslie, you want to introduce yourself real quick?
Out of town, and a lot of people like University, I was their coordinator of ministry, so I'm super excited to be part of this initiative. One of the reasons I felt like to be get behind it in front of us.
Leslie comes to us working with the Governor's Challenge. She'll be our administrator running, making sure it's moving smoothly along the lines. We have 3 other staff, one in Department of Health and one in FSSA that are funded through that. And then we've got our other staff that will be joining soon. All 3 of those have been identified and we're just finishing up the process for it. We have, he's not here, but Devin Sprung is our Director of IT. We created a partnership. They came and asked us and we said, sure, with IoT, where they pay for a portion, we pay for a portion. And we then have an IT director, which with all the IT stuff we've been doing, we really need. It's allowed us to then push forward with our program to update the Military Family Relief Fund technology that we're utilizing. And Tim's leading that project with giving it to Devin to lead that project, which makes it great that we can have someone we can hand off and give them those tasks. I'll hit another project that I'm asking him to do here in a little bit. Our state approved agency staff have been fully staffed and we're excited that that has been fully staffed. And we will have 3 more staff coming on board. As I had mentioned today, before we have the State Crisis Intervention Planning Program grant from the feds. We're working to get our final approval document into them to get final approval. Once we have that approval, then we can hire staff. We'll hire a finance staff that will be part funded by that and be able to funded by some others so that they can do finance for the whole thing, the little agency. We don't have a finance staff except for Tim, and Tim's tired of being a finance staff member. We'll hire a grant staff.
He's an army of one.
Yeah, exactly. Exactly.
Couldn't resist.
Great. That's a good call. That's a good call. That's a good one. We're going to have to put that one on your review. And then we'll have a program staff that will be under Joe's because the state crisis intervention aligns with the Governor's Challenge work. So Governor's Challenge, we hire the staff. We've got 2 counties, community coalitions that are in process for their planning grants and doing that work. And we'll be looking forward to, Joe, your stretch goal is around 10 or so more by the end of the year to get planning. And then as they get the plan done, they'll be getting funded to start their activities for that.
Hamilton and Hamilton.
It is a coalition around Hamilton County.
Oh.
Yeah, because it's not just the county, it can be around. That's why we've been saying community coalitions versus counties.
Okay.
They align quite often with counties, but it still could be community. And Johnson are our first 2. Joe will have, we'll dive into Governor's Challenge probably next time a little deeper. And Joe's got a prioritization of communities laid out and MFRI with some stuff there. So there's an agenda potential topic that we're going to add up.
Yep.
So any questions on the Governor's Challenge right now, or the SCIP is what we call the State Crisis Grant, the SCIP grant? Okay. Couple other things that are going on. Veterans Home. Amy has been just a great asset up there. We're thrilled with having her there. We just got notified yesterday, actually, that we are going to be receiving, so it's not done until the paperwork's done, but we got notified we're receiving a grant to help do bonuses and other incentive payments for our nursing staff. So that will help us with that. It's a 50-50, so they'll put in, I think we'll get just under 115,000. And so we'll have to put in 150,000, which the agency, the home has to be able to do that. But great partnership with the State Personnel Department to get the right kind of language into that grant so that it would be both approved by feds and legal for the state of us to implement, because they weren't thrilled with our first language. We loved it, thought it was great, but they weren't quite sure we could actually legally implement that across the state. So that was good. But we're very excited by that. Additionally, Gabrielle and Amy are in the final phases of getting the long-term strategy project initiated with the home of what is, and the title kind of is the elder care needs for the veterans of Indiana for the next 20, 30 years. It's not just about long-term care, it's about elder care. And out of that will be things that we'll do, out of that will be things that others will do. Is it just about what, but it's about what are, we have to, what are the veterans' needs? As you heard from Kendall, our aging population.
Right.
So that's important in the context of dropping by 30-some%, if the projections are correct, of the veterans in Indiana over the next couple decades. And we dropped about 30% in the last decade. So I would sense those projections would be more correct than not. So that'll be a very important study, because the veterans home, as we know, with freezing pipes and bursting pipes and other things going on, is old. And we need to understand what is the path forward. And so I have no preconceived notions of what that path forward is. We're going to work to get, and we're hiring an outside entity to do that. In partnership with the federal VA and a couple other groups that we're partnering with on this. So it's not just us looking forward to it. Another kind of longer term thing that I'm just starting to get on my agenda is really veterans benefits in the state and how well are we doing. If you look at some GDX, which is the spreadsheet that the federal VA puts out around benefits that Indiana is receiving in every other state, we can vary it down to every county. We're lower than I think we should be, and we need to improve. But what does improvement look like? I don't know if there's you can't look at one state and go, oh, that's how they're doing better. And so there's work to be done there. And so Tim and I have started to work with folks to think about how to engage in that. There'll be some more studying and some more data analytics work to be able to understand, what it is and then why. And then what are the options that we would do going forward? So you won't hear anything on that for a while, because that's going to take some time to dive into. But the impact of that, if we went from where we're at to number one, that's about a $2 billion a year difference. So I think that's a worthwhile project to be working on. That's the impact that could have, and how we're looking at it. Again, don't know, I have some thoughts of why or how they operate, but we got to go learn. And we
Create a clone of you and
Yeah.
put it in every county.
So it's not just about the data, it's not just about CVSOs. Got a feeling it's a lot about process too. Those are a couple key components. The last thing I was going to mention, that I was additional IT program. I've engaging Devin, and we're working with the Indiana Office of Technology. As you've seen in bills, we have the ability to receive data from BMV. And so we're partnering with them to do some work to get their data even bigger and better around veterans. There's some tools we're working to implement on that. But when I get it, I need a viable place to keep it, a safe, secure database, which we haven't had, a structure that we can then communicate with and modify as we start communicating and learn more about the veterans based upon what they tell us, what they freely give us. So, in Indiana code, I know there's a lot of this discussion right now about selling of BMV data. But in Indiana code, there's a line, and please don't take it away, that says any government entity that for its implementation of its mission can get data from BMV. And so we're working with BMV on that line and Joe actually and I have talked and we're working, the counties get this data for certain purposes. We're working to see if the CVSO could get their veteran data within their county for their purposes. It's allowed by Indiana code. We just have to actually, sometimes it's hard to, I probably didn't see that until year 4.5 and I'm on year 5 starting right now. So something I really hadn't seen, and then we look, oh, hey, look at this. I actually can use that. And so I then said, Joe, I started talking with Joe and it's like, hey, what if you guys could use that? So we're playing out the what if. So we'll see what happens. If it all works, what Joe does, we'll then spread that out across the state to other counties and say, here's the path, here's the process, here's the MOU, here's the document. Go get and start communicating with your veterans. Speaking of that, Representative Bartels wants to talk, but I will let him know that call back in a few. So that's an important, that one I'm just very excited about. It has great opportunities. It will have budget impact because if we build this database, we then have to do outreach and communication to it versus just sit there and do data. So, and that looks like, a marketing cloud from a Salesforce standpoint with, activities and data collection and variable messaging based upon who, what, why, and where. Well, that takes skill sets and tools that we don't quite have yet. So we have to go get those. And so I'll be talking next summer around those issues with our budget, around the budget agency. Two other things. One thing in terms of the state, I just want to highlight that I'm proud of our team and really proud of Laura for getting it going. I asked her to kind of push it, and then I'll be the executive sponsor of the state of Indiana creating a veterans resource group for state employees who are veterans or connected to veterans. There's upwards to 2,000 or more if the percentages work, veterans in the state employment. What a great place to have a veterans resource group that is, that can come together and talk about veterans benefits, veterans issues. We're probably one of the only agencies that could actually legally fund activities along those lines because it fits with what we do. If I could help 2,000 veterans get into their benefits or learn more about veteran services, that's our job. So Laura's, they just had a meeting yesterday. It's being led by others. So we're working to have it led by other veterans in the state employ so that it isn't just an IDVA thing. It is a veterans resource group that is designed, defined, and delivered by the veterans of the state that are employed by the state. And so we makes sense for me to be the executive sponsor of that. And then Laura is really helping drive the process and helping make that go through. So I'm excited about that opportunity going forward. And then last thing I have, and then I'll open any questions, is Kendall talked about homelessness. The homelessness issue is brought very closely to us on this property because this property and the city itself kind of drives the homeless to this property. That's created some significant challenges because this is a working property. And so the American Legion National has had some significant issues with people sleeping in their wells, doing all sorts of things in front of the window. A murder occurred just on the south side of their steps a little while ago. And they see and film and do all sorts of drug activity going on. So we are working with the state police, the Marion County Police, working with the Legion, working with IDVA to address the homelessness issue on this property. It isn't just veterans, but one of the biggest challenges is that the community organizations bring food, which isn't a bad thing into itself, but then they don't do any cleanup. There's no monitoring. There's no procedure. There's no policy. There's a lot of things that aren't going on there, and it creates some problems. A year or two ago, there was a stabbing getting the food. So this is the challenge with that is as a working environment, it's kind of, you got people that don't want to work here because of that, because of the concern and the safety, security of it. So we're trying to address it on the whole, and it's an important situation. It's not something that we just pitch off, but we do have to address it with the city very specifically. And And that's, that there's no small challenges associated with that, because it isn't just one group or one thing that's going to solve that problem. It's an aggregate amount. And the problem goes back decades from, policy decisions that made and different law, federal and everything that comes into play. So it is what it is, but just wanted to let you know that that's a concern. Last thing, if you notice on the other.
Could I just
Yeah.
throw in one thing? General Goodwin's staff does a wonderful job
Yeah, they do.
keeping the property looking beautiful. Tim and I have a little friendly competition of who's the first one here in the morning. And
I lose every day.
when we get here, the entire lawn is littered with to-go containers, ketchup packets, food. I mean, you name it, it's literally just sprawn across the lawn. And then if I were to go out to my car, by 8 o'clock, that it's gone and it looks pristine again. So I just wanted to share on that topic, the great work that General Goodwin and his team does to keep this property looking as it should, to honor those who served. Thank you, Dan.
Yep, that's, they're always humbled by the work that they do. Last, you'll notice the other side of the hall, we had nonprofits up there previously. Frankly, they were only using it for storage, really weren't bringing any additional veterans up into the building. So they did vacate. We did cancel their leases. And part of it was, you heard all the staff that we have. We don't have any other space downstairs. So that space we'll be working to modify slightly because we need some locks and there's no doors on that. And if we're going to have working offices up there, we'll need some doors. But yeah, you'll start to see, we're working to get bids and we got some stuff going on that, but you'll see that coming forward, that staff will be going in there and we'll be operating there on the other side of this floor. So that it kind of is what it is. But they weren't really being used to bring veterans in to this building to do anything with. And so our staff will continue to do that. So those are the things I've got. I just wanted to highlight real quick. It was said earlier, and that's where, we're blessed in that both myself and the staff have great staff around them. And that is the only way that we do good things, is because no one of us, Joe can't do it all on his own. Tim can't, I can't, Gabrielle can't, Amy can't. We have to have good staff around us. And we've been very successful at working through that and getting great people on board. And that just shows. It shows, one comment I got, Mayor Greg Ballard, who used to be on this commission, moved away to South Carolina for a couple of years and it didn't take. They're back, when they are back in the community. And one of his first comments he said to me was, "Boy, the whole feel is different, Dennis." Just when he left, the feel of, and when he was around here, didn't, and he said, come back and it's a different feel. It's a different communication. It's a different connection. And that goes to all of you folks also, because it takes you guys to partner and connect for us to be able to make that happen. So I thank all of you for that. And thanks for that. So with that, I've got 7 minutes left that I will then cede back to you, sir.
No.
Or any questions?
Any questions for Director Weimer before we move on? Stu, any comments on what we're doing or what's going on in the commission or the department?
Nope.
Mark?
I'm good.
More beer meetings?
Kevin? Joe?
Yes, sir.
A couple of comments that everybody might have heard. Remember we had the middle of honor highway designation. Massachusetts has finally passed it all.
Oh, did they? Good deal.
Washington, it's before Congress. The Senate has unanimously passed it, the designation to make it a federal highway.
Oh, great.
It's going before the House, they're talking budget issues, so we don't know when that'll settle down. But the key is they plan on having some big ceremonial thing, whether individual states or out in Washington. And hopefully when we find that out.
Oh, yeah. That'd
Might
be great.
be there. That being said, unlike Kevin, I am retiring. I am not running. I'm officially done on November the 6th, but after session, we'll wind it down. There is somebody I recommended to the speaker. He's a member of the Veterans Committee. He's an Iraqi war vet, and he's also a member of Ways and Means. So that is a key position. I hope that Speaker Houston follows up with that. I'm trying to encourage him to make that appointment when it's obvious in the next few weeks that I didn't sign up to run again, that I'm not running. So it doesn't look like he's me out, because his domicile is real close to where your next meeting is, which happens to be the day before my 54th wedding anniversary. And I have been told ceremoniously or not by my wife, she does not intend to be back in Indiana yet in April. And if I want to be with her, I will be in Florida. So you can see the pressure.
It's a tough
Yeah.
choice.
So even though you're coming up to close to my neck of the woods,
You're not gonna be there.
well, and I believe you're from out down here. My son's works with the Veterans Court. He's Superior Court criminal judge, Frank Gall, Steve Patrick. They do a good job.
It's an amazing program.
So anyways, that being said, you gave me the floor for a minute and I took two.
But we appreciate it very much. We're glad to have you on the commission the several years that you've been here, many years that you've been here. Rick,
I need more information on Fort Wayne. Said you'd bring it.
we're gonna
at the
talk
end.
about that
Yeah,
before we adjourn. Colonel?
No, sir.
No, sir.
It's north, just drive north.
Gabrielle?
No.
No. Well, before we adjourn, I've already thanked the department and everybody, but I want to talk about upcoming meetings. We had a little discussion before the meeting about the meeting in Fort Wayne and the hours of that meeting. And I mentioned that, and I believe it's true, and Gabrielle can correct me if I'm wrong, or Dennis can, that if you want to go to Fort Wayne and spend the evening, I think you can do that under expenses, because if you're not aware of it, especially the new members, well, you probably wouldn't need to have expenses, but you can file for expenses on your travel to these meetings. I mean, that's just part of it. I don't think I've ever actually done it. I think I have a vendor ID, but I don't believe I've ever done it.
Work with Kelly.
Yeah, but you can get a vendor ID, which will allow you to then turn in expenses. I know you have to drive down there all the time, and if you want to do that, that would be fabulous. And Rick has to drive quite a way. The rest of us are local, but but anyhow, if you want to go to Fort Wayne, we really want all the commissioners to try to be there. I know it's going to be an evening meeting. And if you want to spend the night, then that's fine. You just have to make arrangements and get your, turn in your expenses when you're done. And so Joe's going to work with us on getting a
Right.
location for
We're going to
that.
talk to Joe DeVito
Yep.
after the meeting's over.
Okay, all right. So we'll hopefully have a location for that pretty soon. Yeah, Mark.
Our national meetings are here during that time.
Oh, is it?
We get that squared away. Okay. So I thought we had squared.
I thought we looked at all that. We'll have to try to figure that out.
What?
I thought we'd looked at all that before because we tried to coordinate.
If I have it wrong on my calendar.
I believe you.
Yeah,
But so
we may need
let's,
to review.
we'll check on that, because we've been trying to avoid all of those, which in the spring is hard.
Right.
Because they have, and then the late summer is hard too, but so we'll take a look at that and see what we have to do.
And then you can see our next meetings there, where they're at and what the times are. So I don't think there's any need for discussion on that. But
Could you just share what we've discussed as why we're trying one at 6 o'clock at night?
well, we talked about that a little bit earlier. We're trying to get more community involvement. And if with Joe's help and all the VSO's help, I think we could probably get some actual public at a meeting instead of just us talking to each other. We'd love to have public involvement. We had one in Richmond
Yes,
2 years ago now.
no, more recently than that.
Was it more? And we had a fairly good crowd. I mean, we probably had 20 people, maybe 20 people. We had one in Evansville and we had a few, not a lot, maybe 5 or 10 people. But we'd like to really get the community involved and hear from them when we have these meetings. That's the whole purpose of the commission meeting, is to get the public involved, and we very seldom have public comment. So that's why we're doing it at 6 o'clock in the evening. Hopefully we can get people there. We may have to entice them with something. I don't know what, but
You have a location?
they're going to work on that after this meeting. Any other comments on the upcoming meetings? If not, I'll entertain a motion to adjourn.
Make the motion to adjourn.
Second.
So moved. We don't need a vote on that.
Just don't do
Anybody
it.
would like to stay, go ahead. We'll put you to work.
Yeah,
so.
clean it up, put the chairs back in order.
You were right.
What's that?
You were right. I looked them up.
I think, because where we, because I was like, oh, we worked around all those.